If you've been diagnosed with rheumatoid arthritis, there's a critical window of time where you can stop joint damage before it ever begins. Miss that and it gets much harder to reverse. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with the most effective and cutting-edge treatments available. Today, we're talking about joint deformities in rheumatoid arthritis. These are the visible changes in your joints that occur when the disease is not caught and treated early. The good news, they're not inevitable, and in fact, with the right approach, they should be preventable. There's a window of opportunity, especially in the early stages of RA, where aggressive, personalized treatment can prevent permanent joint damage and deformity. Let's walk through what these deformities are, why they happen, and most importantly, how we prevent them. Joint deformities are permanent structural changes that occur when RA is not well controlled. These aren't just cosmetic issues. They impact function, mobility, and quality of life. Common examples include ulnar deviation of the knuckles. Your fingers start drifting toward the pinky side. Boutonniere deformities. There's a bent middle joint with an extended tip. Swan neck deformity, where you have a hyperextended middle joint and a flex tip. Z joint deformity, a zigzag pattern in the thumb itself. Foot deformities, collapsed arches, curled up toes. Neck or cervical spine changes, less common but serious as well. Once these deformities set in, they're difficult, if not impossible, to reverse, which is why early intervention is everything. RA is an autoimmune disease. Your immune system mistakenly attacks your joints, leading to inflammation in the lining of the joints. Over time, that can lead to cartilage breakdown. The bone will get eroded. The ligaments get overstretched and weakened, and the joints start to shift and collapse. This process takes time, but without proper treatment, it's progressive and predictable. Here's the key message though. You can prevent joint deformities if you act early. The first 3 to 6 months after symptoms begin are considered a key window of opportunity in rheumatoid arthritis. This is when treatment can stop inflammation and prevent joint damage before it becomes permanent. Miss this window, and it extends to up to a year, and the risk of deformity and disability increases dramatically. This is why early diagnosis and starting the right treatment quickly is essential. Biologic medications have transformed how we treat rheumatoid arthritis. These are targeted therapies that calm the immune system and stop inflammation at the source. They are not Band-Aids. They are disease-modifying treatments. If you have moderate to severe RA, especially with lab abnormalities, joint swelling, or signs of damage on imaging, biologics are often the right next step. Used early, they can prevent joint deformities, preserve function, and stop the disease from progressing. I want to be clear, no supplement, diet, or injection can replace biologic medications in someone with active high-risk RA. These medications save joints and protect your future. The great thing is that this has been the standard of how we treat rheumatoid arthritis for the last 30 years now. And it's a treatment, modality, and approach that you should be considering if you have active RA. In my practice, we also specialize in what's called orthobiologic treatments. These are regenerative medicine treatments like platelet-rich plasma, bone marrow concentrated stem cells, and prolotherapy. These are powerful tools, and their role in RA is very specific. These treatments are not a replacement for the biologic medications in patients with active inflammatory RA. However, they can be helpful in a couple situations. To begin with, if we're treating chronic joint instability or wear and tear osteoarthritis, which can develop in people with long-standing RA, even when the inflammation is controlled. The regenerative medicine treatments can be helpful in those cases. In addition, if there's supporting soft tissue around a damaged joint, it can help to stabilize ligaments and reduce pain when inflammation is no longer active. In short, RA meds stop the fire. The regenerative medicine treatments help to rebuild after the fire is out. If you've been diagnosed with early or mild RA, with no active inflammation on imaging, exams, or labs, no joint damage, and only mild symptoms, it may be reasonable to try conservative care. That can include anti-inflammatory diet, anti-inflammatory supplements, regular physical activity, and periodic imaging and lab monitoring. This last one is very key. If there's any signs of active inflammation, getting started on more appropriate disease-modifying medication treatment is essential to catch things in that key window of opportunity. Even with mild disease, this must be done with close follow-up. If inflammation increases or imaging shows any signs of active disease, we escalate quickly to protect your joints. If deformity is already present, it's still not too late. The goal shifts from prevention to stopping progression, improving stability, reducing pain, and improving your function. In those cases, we may use a combination of the biologic medications to keep inflammation controlled, the regenerative medicine injection treatments for soft tissue support and treating any chronic wear and tear arthritis pain, bracing, hand therapy, physical therapy, and lastly, surgery if absolutely needed as well. You still have options, and the earlier that you act, the better your results. Let's be really clear, joint deformities in RA are not inevitable. There is a key window of opportunity, usually in the first year of symptoms, where proper treatment can fully prevent them. Biologic medications are revolutionary and are the foundation for protecting joints from long-term damage. The regenerative medicine treatments play a supportive role in managing joint damage or instability. They're not a substitute for systemic RA control. Every patient deserves a personalized plan based on their severity, goals, and risk factors. RA is a serious condition, but we now have proper, powerful tools to prevent its worst complications. Do not wait until you see visible damage. The best outcomes happen when we act early, before deformities and permanent damage have started. If you or someone you love is living with rheumatoid arthritis, reach out. Early diagnosis and the right treatment can make all the difference. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert insights on staying pain-free and protecting your joints. Until we connect again, stay healthy and live well.